Hello everyone, this is Dr. Neha Dubey and today we are going to discuss on the topic ultraviolet radiation therapy. So as the name suggests, ultraviolet radiation. As this name comes to our mind, the very first thing that is strike is the sun. As we all know, the sun is the primary source for ultraviolet radiation. So let's get started with our topic with the very first slide that is covering the introduction part of the UVR. So let me tell you in detail that UVR therapy was first stated by the work of the Danish physician Niels Finsen. So basically UV therapy uses ultraviolet spectrum energy and its recognition of sunlight therapeutic effect dates back to the ancient times. So these are the natural source, basically the natural source is coming from the sun, and the artificial UV radiation which is having these specific wavelength inbuilt inside the machine for the precise dosing is available since last century only. So UVA in 1974 means UVA was discovered in 1974, UVB in 1984, UVAB in 1985 and UVA1 was introduced in the year 1992. So this is not so ancient times, this is so new machine, this is not so old. So let us discuss first with the definition of the ultraviolet radiation. So ultraviolet radiation, as the name indicates, these are the non-ionizing radiation that lies between the visible and the X-ray light in the electromagnetic spectrum. As you can see here in this diagram, this is the ultraviolet radiation and it is lying between the visible and the X-ray lights. So its frequency is ranging between 7.5 to 10 to the power 14 and 15 Hertz with its wavelength that vary from 400 nanometer to below 290 nanometers. So come to the next slide, that is the classification, that is covering the classification part. So I have already discussed this, that the sun is the natural source from where we get this UV radiations, all the wavelength. So the artificial way of inbuilting these wavelength inside the machine is being classified into three types. The first one is the UVA. It consisting of a long wave and its wavelength is 315 to 400 nanometer. The second rays is the UVB rays and it basically these are the middle waves and its wavelength is ranging from 280 to 315 nanometer. The last type of UVR rays is the UVC, which is the short wave and its wavelength is from below 218 nanometer. So you can see here in this diagram, this is the natural source of emitting the UV rays of UVA, B and C. These are naturally occurring waves. UVA with a wavelength of 315 to 400 nanometer, and you can see it is striking the troposphere and the stratosphere layer of the environment. The second one is the UVB. You can see here it is 218 to 315 nanometer and it is covering an altitude above altitude of 50 kilometer. And the last one is the UVC, that is actually covering the 100 to 280 nanometer wavelength and it is basically absorbed in the outer space. Most commonly it is absorbed in the outer space. So this is basically the natural way of getting the UVR types A, B and C. But what I have discussed here, these are artificial way of producing these wavelengths, these natural wavelengths artificially in the machine itself for therapeutic purpose, just to treat patient conditions. So here I am going to tell you one more thing, why we are studying this UV radiations. Because UV radiation is basically very important to treat the skin disorders conditions, for example like psoriasis, acne vulgaris is there, vitiligo, leukoderma spots are there, and most commonly it can also go for many other conditions like alopecia areata, universalis alopecia. So yes, this machine can work on these specific areas. So now I am going to discuss the next slide, that is actually covering the UVR generators. Basically generators here referred to as lamps. How many kinds of artificial lamps are there that are actually producing UVA, UVB and UVC wavelength radiations? So the very first one is the mercury vapor lamp. Now when I am talking about mercury vapor lamp, so mercury vapor lamp are divided into two parts, the high pressure mercury vapor burner and the chromium lamp. The second one is the fluorescent lamps, and it is covering the Thoracton tunnel and the PUVA apparatus. So we will be discussing one by one all the types of lamps. So first of all, I am going to discuss about the mercury vapor lamp high pressure lamp. So let us discuss high pressure mercury vapor burner. So as you can see here, it is written, it is a U-shaped tube. Basically this is a machine which is having inside the construction and working. I am telling you the construction and working of this mercury vapor lamp, how this machine looks like and what are its function, how its work. So it is a U-shaped tube. So and it is this tube is basically made up of quartz crystal, which is enclosed with the argon gas of low pressure, with a small quantity of mercury vapor is also enclosed in it. Now the tube is sealed by both the ends with the metal caps, okay, and a high potential difference is present to ionize this argon gas. So now I will explain you referring through this diagram. So this is basically how it looks like from inside. Okay, so first of all, what we will do, AC means, so we all know that this is the alternating current which is actually producing the current of around 220 volts. Okay, so when this is striking our machine, so machine is actually having an inbuilt structure known as a step-up transformer. So this 220 voltage current when get into the step-up transformer, so it is converted into 400 voltage. Now this 400 voltage is actually what we are talking about, initial ionizing voltage. So this is basically a spark. Whenever you just on the machine, it sparks and immediately it gives a 400 voltage current. So now this 400 voltage current, what it exactly do, you can see here the diagram. This is the metal cap and these are the electrode. The electrodes are like everyone is knowing. The first electrode, the one will be positive charge and the other one will be the negative charge. This is a U-shaped tube and it is basically made up of quartz crystal. Now why quartz crystal only? Why not some other crystal? Why we can use a quartz crystal? Because its specific properties, it can withhold the very high potential difference. If we apply it, so it can withhold that energy and is unable to deform from its shape and size. So that's why we are using this quartz crystal in our tubes. So you can see here inside the tube there is a filling of a argon gas. Now if I am talking about this argon gas, so everyone is knowing that argon gas is complete in its outermost orbit. That's why it is called as an inert gas or a stable gas. So why I am using this stable gas at a low pressure? Why not I am using some other gas which is actually not configured in its outermost shell? The reason behind this is it is already completed. So when the high potential spark is applied to this tube, so immediately this argon orbit splits into two parts. The first part becomes the positive ion and the other part that is being spitted out is become the negative charge ion. So what happened is, I have already told you this is the positive charge and this is the negative charge. So what it do, the negative part rush towards the positive ions and the positive parts rush towards the negative electrode. So this movement and distortion of the ion within the tube actually heat up this vessel, and because of this heat up, this mercury get vaporized, and vaporized with a high potential difference. Vaporization results in the emission of UV radiations, and basically UV radiation, it is emitting the UV radiation, but somehow it is also emitting visible light also with it. Okay, so this is one of the drawback which this machine is actually having along with this. So this is how exactly this mercury vapor lamp work inside the machine. This is the inside of mercury vapor lamp. Let me show you the machine how it looks from the outside. This is actually how this machine looks from the outside. You can see here this is a burner. Okay, so what you have to do prior giving this prior application to this machine, the very first step is you have to switch on the machine prior 5 or 10 minutes before the treatment starts. Very first thing. Second thing is, because this is a mercury vapor lamp and this is having one demerit, that the tube or the filament which is having this argon gas is heated up, and because of this heated up, I cannot apply this machine directly or in the close contact with the patient skin. So I have to keep in mind whenever I am giving this thing, so there should be a distance of around 50 to 80 centimeter distance should be there from the this machine, this apparatus and the patient skin. So there should be this much of distance between the patient and the machine. Otherwise, if you are applying in the very close proximity, so it can cause burn, it can cause erythematic spots also on that particular exposed area. So you have to be very careful while applying this. This machine is also having one more drawback, that is mercury vapor lamp emits short UV rays. Now these short UV rays again creating a side effect on the disordered skin. Well, for example, acne vulgaris. So what it will do, it will enhance the diameter, enhance the area of infection. So it will increase that. So basically we prefer not to use in a very close proximity between the lamp and the patient's skin. So we have to be very careful while we are using this mercury vapor lamp to a patient's skin. So the other, I think this the very first type is clear to you. Now moving to the next lamp, that is the chromier lamp. So the chromier lamp working is actually almost same, just like the high pressure mercury vapor lamp. So what is the difference? The difference is only there it contains a water cooled mercury vapor. Water cooled jacket is there inside it. So let me show you here. So two things that actually differ it from the high pressure mercury vapor lamp is this. The first one, it's very compact, it's very handy, it's a handheld. From here you can just hold it, grasp it like this. The second thing is you can directly place it on the patient's skin, in a direct contact with the patient. Why? Because see, I have told you already that the working is almost same, just like a high pressure mercury vapor lamp, because that also contains mercury vapor. This machine also contains the mercury vapor. So the only difference is there, this here, this is the difference. It contains, chromier lamp contain the water jacket. Now water jacket, what it do is, whenever the filament get heated up, so it cools down and you can directly apply this thing on the patient's skin. So yes, this is the basically difference between both the instrument. And one more thing, because this is a very handheld device, it's very easy, lightweighted and compact to use. So you can generally use it as a transport. For example, if you are going from one clinic to other clinic, or if you are visiting to a patient in their houses. So basically this is the lamp of choice, just to visit from one place to another place. So this is actually how it works. So I think it's been understood by you how this high pressure mercury vapor lamp and the chromier lamp work, and what are its construction parts all about. So the next lamp I will be talking about is the fluorescent lamp. So why we are using the fluorescent lamp again is the question, and the answer to this is, see, in the I've previously told you that in the mercury vapor lamp there is one demerit, that it emits short UV rays. That is actually creating a side effect on already disordered skin. So just to avoid these kind of things, fluorescent tubes are being discovered. Now what this fluorescent tube is something different. Why this tube is so different? Because the very first thing, it's a cylindrical tube or it's a circular tube. Okay, it's a 1 centimeter long tube and it is having a special coating outside of phosphor. Now what does phosphor do? Phosphor only emit the UV radiation. It absorbs IRR rays, it absorbs the visible light rays, and it also absorbs the short UV rays. Now what is emitting out is the long UV rays, which actually we need for this treatment purpose. So that's why the fluorescent tubes are actually very important to be used on the patient part. So basically it contains the two lamps. The first one is the Thurectan tunnel and the other one is the PUVA apparatus. So we will be discussing this one by one. So very first is the Thurectan tunnel. It is a semi-cylindrical frame in which 4 fluorescent tubes are being present. So let me explain you how it works. See, it's a somewhat like semi-cylindrical shape is there, and it is having 4 fluorescent tubes and it is fitted in all its curves. Okay, 4 fluorescent tube of 1 centimeter long, it is present and it is covering all the 4 part, it's all curves. Each tube is mounted in its own reflector. Fluorescent tube emits UV rays with a spectrum of 218 to 400 nanometer. This is basically its wavelength, what it is emitting out. So yes, this is the Therectin tunnel which is actually using again. The next apparatus which we are talking about is the PUVA apparatus. So let me discuss this thing. This is very interesting. Why? Because the name, as the name indicates, P is a photosensitizing agent known as a sorolin. And UVA, I have already told you, UVR contain 3 types of wavelength. The first is a UVA, which is actually, so basically PUVA is actually emitting only the wavelength covering. Let me show you again the very first slide which is having this. UVA, it's a long wave and it is emitting a wavelength of 315 to 400 nanometer. So basically the PUVA apparatus is only emitting this much of wavelength. Other than this, the rest of the machine is emitting UVA, B and C, all the 3 kinds. But PUVA is actually emitting only 315 to 400 nanometer wavelength. So this is basically the difference. Okay. So let me tell you again. So these are the photosensitizing agents called as a sorolin, which is actually used as a lotion. So what you have to do, prior application to UVR, like 2 hours before, the patient need to apply the sorolin on its body itself, expose the part, and then you have to wear the goggles, and then you have to stand in this chamber. This is the chamber of UV radiation. Now what this chamber speciality is all about, so this chamber actually contains that fluorescent tubes that I am talking earlier on the Therectin tunnel. That 120 centimeter tubes is being fitted of around like 50 to 60 tubes are being fitted all over in this chamber. Okay, so what you have to do, you have to, the patient have to wear the goggles. Okay, and you have to put your that photosensitizing agent called the sorolin on the body. Okay, now you have to after completion of 2 hours, you just have to stand there, close the door, and you have to take your whatever the dose has been calculated for you. You have to take that dose for that particular time period, and then you have to come back. Okay, so this is exactly how this PUVA chamber is looking like. Okay, and this is very expensive. Everybody cannot afford this kind of PUVA apparatus. Okay, this is, see, there are 2 kinds of PUVA chambers. You can see here, these are the cylindrical these are the tube-like rods of 120 centimeter. There is one more chamber. Let me show you. This is again one more chamber. You can see here, these are the circular bulb-like structure. This is also the same thing. This is also the PUVA machine. Okay, but it is having the circular shape lamps in it. Okay, so only the difference is there. It contains the circular shape or the long tubes of 120 centimeters of phosphor coating. That's all thing you have to keep in mind while applying this modality. So basically this is all about in our this lecture. I have already told you, let me revise it again. So I have discussed about the introduction part. I have discussed about what is ultraviolet radiation and what it basically comes, where it comes in the electromagnetic spectrum, its type, how many types of wavelength it emits. Okay, next I have explained you about its generators, the lamps. There are 2 kinds of lamp, mercury vapor lamp, it consisting of again 2 subtypes, high pressure mercury vapor burner and the chromium lamp. The other one is the fluorescent lamp. It is again of sub 2 types, Therectin tunnel and PUVA apparatus. All these are having some specifications and construction and working which I have already told you, and I hope you understand it. Please grasp my lecture again. Please if you understand it, read it again, and thank you so much. Thank you.